Hello guys, welcome back to my YouTube channel. In case you are watching this video for the first time, please consider clicking that subscription button, and if you are a returning subscriber, thank you very much. Please guys, today I want to talk about something that is very special and very crucial. People are living with cerebral palsy, and usually people see those kids or those people as a curse in their family, or maybe their parents did something wrong. That is why they gave birth to a kid with a cerebral palsy. So today I will define what is a cerebral palsy, what are the signs and symptoms of cerebral palsy, what are the risk factors of the cerebral palsy, what are the causes of cerebral palsy, how can you live with someone who is having cerebral palsy, what are the complications of cerebral palsy. Maybe I will add others apart from whatever I've just said, and please make sure you watch this video up to the end. So what is cerebral palsy? Cerebral palsy is a disorder of movement, muscle tone, or posture that is caused by an insult to immature developing brain, most often before birth. It usually happens before birth. And what are signs and symptoms that will appear during infancy and preschool years child? In general, cerebral palsy causes impaired movement associated with aggravated reflex, floppiness or rigidity of limbs and trunks, abnormal posture, involuntary muscle, and steadiness of the walking, or some combination of this may also appear. People with cerebral palsy may have difficulty with swallowing and commonly have eye muscle imbalance. People with cerebral palsy may have reduced range of motion at various joints of their bodies, and due to muscle stiffness. This is due to muscle stiffness. The effects of cerebral palsy on functional ability varies greatly. Some people may able to walk while others are not able to walk at all. Some people show normal to near normal intellectual function, but others may have intellectual disability, and they may also present with epilepsy, blindness or deafness. Also may be present. People with cerebral palsy often have underlying developmental brain abnormality. You get that these people with cerebral palsy, they may have abnormality in the brain. So what are the signs and symptoms of the cerebral palsy? How can you know this person is having a cerebral palsy? Or when you see a child who's maybe the parents are saying it was a curse, or maybe the community is disowning this child because they are saying their parent did something bad, that is why they gave birth to a child with cerebral palsy. What are the signs and symptoms that you may be able to tell this parent or these people that this person is having just a cerebral palsy and they need to take care of this child? So there are number one sign, there is variation in muscle tone, such as being either they can be more stiff or more sloppy. They can variation in muscle tone. I think you feel what I'm saying. There can be stiffness of muscle or exaggerated but exaggerated reflexes. Yes, and that one we call it spasticity. And the child can also present with stiff muscle with normal reflexes, and that one we call rigidity. There can be lack of muscle coordination. There we call it ataxia. Tremors, all involuntary muscles can also present. Slowness within movement. Atetosia, that one we call atetosia. Delay in reaching motor skill. Delayed milestone. Difficulty in walking, excessive drooling. You get that a child will present with excessive drooling, and also this person may have abnormality in the brain. They may not be normal people. They cannot think as a normal person can think. This person will also have difficulty with vision and hearing. Seizures can present. Oral diseases, because there is problem in muscle coordination of the mouth. Mental health, they can present with psychiatric condition, urinary incontinence, and maybe sometimes they will be wearing pampers the whole of their life. What are the causes of cerebral palsy? You get that cerebral palsy is caused by abnormality or disruption in the brain development. What have I said? I have said it is caused by abnormality or disruption in brain development, usually before a child is born. So there were notions that sometimes cerebral palsy usually happen when somebody before birth, but in real sense sometimes it can happen before the person is born because of the abnormality or disruption in the brain development. Usually I've said usually before a child is born. In many cases, the exact trigger of this abnormality is not known. We don't know the exact trigger or of the exact cause. Factors that may lead to problem with brain development include, these are just factors that can lead, because I've said it is caused by abnormality or disruption in brain development, usually before a child is born. So what are these factors that can lead to problems with the brain development? It can be random mutations in genes that control brain development. That one can be one cause. Maternal infection that affect the developing fetus. That one can also cause, maybe if you are having syphilis or these conditions that can cross the placenta and the fetus get infected, you can give birth to a kid or a child that is having a cerebral palsy. Number 3 is fetal stroke or disruption of blood supply to the brain when the brain is developing. That is, maybe when we are having anemia during pregnancy, this one can contribute. Lack of oxygen to the brain related to difficulty labor or delivery that may cause asphyxia. This is rarely a cause, but it can cause it sometimes. Infant infection that cause inflammation in or around the brain can also contribute. Traumatic head injury in an infant from a motor vehicle or accident or a fall can cause cerebral palsy. So those are just some of the causes that may contribute to that disruption of brain development, and you might give birth to a child with a cerebral palsy. So what are the risk factors of cerebral palsy? What are the risk factors of cerebral palsy? A number of factors are associated with an increased risk of cerebral palsy. So number 1, we have maternal health, we have infant illness, and we have other factors can also be a risk factors of cerebral palsy. So measles rubella can be when you have a measles when you are pregnant, you can give birth to a child, because remember I said contributing factors to cerebral palsy is infection. So those who have measles rubella during pregnancy can give birth to a child with cerebral palsy. We have chicken pox. If you have chicken pox during your pregnancy, you can give birth to a child with cerebral palsy. We have syphilis. I had already said that. Exposure to toxins such as methyl mercury can increase the risk of birth effects, and you can give birth to a child with cerebral palsy. And other conditions such as thyroid problem, intellectual disabilities, or seizures or convulsion during pregnancy can contribute. What are these? Infant illness. Bacterial meningitis can make your child to have a cerebral palsy. And another one is viral encephalitis can also make your child to have a cerebral palsy. And several untreated jaundice also can cause cerebral palsy. We have other factors during pregnancy and birth, such as premature birth, low birth weight, breech birth, multiple babies. This can also cause cerebral palsy. What are some of the complications of cerebral palsy? Muscle weakness, muscle spasticity, and coordination problem can contribute to a number of complications either during childhood or later during adulthood. So if you have this cerebral palsy, or if your kid or if your relative is suffering from a cerebral palsy, you might do what? The patient might suffer this complication such as contractures. Contractures is the shortening of the muscle tissue due to severe tightening of the muscles. Contracture can inhibit bone growth, cause bone to bend, and result in joint deformity and dislocation or partial dislocation. We have another complication is malnutrition, where a child may suffer from malnutrition because a problem of swallowing or feeding problem can make it difficult for someone to have a cerebral can make it difficult to someone who is having a cerebral palsy. A patient can also suffer mental health condition. They can also suffer lung diseases and neurological condition. People with cerebral palsy may be more likely to develop problem disorder or worsen neurological symptoms over time. And those are some of the complications that might happen to someone who is suffering from cerebral palsy. So I think those are how can you treat cerebral palsy? How can you treat cerebral palsy? Cerebral palsy is a lifetime condition, and treating it can be impossible, and it can be managed with a variety of technician, pediatrician, orthopedic surgeon, psychological, occupational therapist, speech language therapist. So many teams can involve in managing this child, and this child maybe will have to cope with life. So pediatrician will be able to oversee the treatment plan and medical care. Orthopedic doctor trained in treating muscles and tone disorder may also be involved. Physical therapist also may help your child to improve strength and walking skill and stretch muscles. Occupational therapy can provide therapy to your child to develop daily skills and to learn how to use adaptive products that will help daily activity. Speech language, you know what that one will do, help your child to maybe to speak when they have difficulty in speaking, swallowing, and oral language. Development therapies. A development therapist may provide therapy to help your child develop age appropriate behavior, social skill, and interpersonal skills. Social worker may involve in assisting your family with finding services and planning for. So what are the modifications that may be given to a person who is suffering from a cerebral palsy? We have isolated, let me say this. Medication that can lessen the tightening of muscle may be used to improve functional abilities, treat pain, and manage complications related to spasticity or other cerebral palsy symptoms. It is important to talk about the risk of the drug also that may set in, and maybe I will tell you. So another thing that I want to say is that the drug that may involve in the treatment could not isolated spasticity drugs such as Badox. Badox injection is given may help to improve drooling. Your child will need to inject about every 3 months, and side effects may include pain, bruisings, or severe weakness may also set in when the person is injected, when the child is injected with Botox. I don't know how to pronounce this drug, but it is called Botox. I don't know. And also we have generalized spasticity. This one we can inject Valium. We can also inject Dantrium, and also you can be given galbofin. So if the whole body is affected or muscles, relaxation may okay, if the whole body is affected, oral muscle relaxation may relax stiffness, contracted muscles also, and that this drug will help to do what? To relax those muscles. So side effects of dantrolene include sleepiness, nausea, and diarrhea. So what are the, how can you live with a person who has a condition that I'm speaking about? How can you live with a person with cerebral palsy? The child will need a lot of support from the society, from the hospital, from the parents, everybody around that child will need a support, because they have difficulty in swallowing. They need to be trained, they need to be helped, they may need supportive equipment. Some of them may need walking sticks, some of them may need wheelchairs, some of them they may need a lot of supportive equipments so that they can cope with this condition. And also they need to be taken, their nutrition may need to be taken care of so that they don't get malnourished. I think those are some of the information that you might want to know about cerebral palsy, and maybe nobody is talking about. So today I've said it. And guys, if you like this content, please support me by just subscribing to my channel. Bye, let's meet in my next video.